I'm John Lloyd, consultant knee surgeon at the Aneurin Bevan University Health Board. The knee joint is the largest and probably most complex joint in the human body. There are various designs of knee replacement which aim to replace the arthritic joint, but none are able to truly replicate a normal knee. A knee replacement is the final treatment option for managing severe end-stage arthritis. It is firstly a pain relief operation, which also hopes to improve function and mobility. Nationally, 86,000 knee replacements were performed in 2013, with the average age of the patient being 70. The ideal person for a knee replacement would be a fit, motivated, and non-smoking elderly individual with healthy weight and a diagnosis of end-stage arthritis. The pain and symptoms should match with the X-ray changes, and they should have exhausted all other treatment options. If you have surgery, you can expect to stay in hospital for 3 to 4 days. You will be assisted to get out of bed and to start exercising your knee joint as soon as possible. The physiotherapist will show you a series of exercises and help you to start walking on your knee joint. To get the best possible outcome, it is very important that you work to increase the movement and strengthen your knee by following these exercises and the advice of the physiotherapists. The aim is to achieve a functional bend in the knee so that you're able to stand up and sit down out of a chair and get in and out of bed before going home. Knee replacements are painful procedures. It's important that pain levels are controlled to enable exercise. In the first 6 weeks following surgery, many patients will say that they wish they had not had the operation. The pain slowly settles and the strength returns as the range of movement in the knee increases and walking patterns return to normal. It can take up to a year to restore normal function in the knee. Following advice on pain relief, exercise and walking practice is essential for this process. Information from the National Joint Registry has shown that there's about 5% risk of revision surgery at 10 years following their knee replacement. This means that 5% of patients who have the surgery, the knee replacement may have to be changed within 10 years. This risk is halved if you're over the age of 75 at the time of your first operation, and it's double if you're under the age of 55. In other words, the older you are when you have your knee replacement, the less likely you are to require further surgery. Your first joint replacement is likely to be your best one, which means that any redo surgery is a more complex undertaking and the results are less satisfactory. Most people are very pleased with their new knee replacement. For some people, the knee replacement doesn't always meet their hopes and expectations or relieve all of their pain. In a very small number of people, they will wish that they had never had one. Sadly, it is impossible to turn back the clock. Final outcome and satisfaction is based on technically sound surgery, but most importantly, there has to be a realistic expectation of what can be achieved and a great deal of patient motivation and hard work in order to regain good function. If you wish to discuss this further, then please ask your GP for a referral.